Unfortunately, I couldn't make it to the meeting in Benghazi because of the accreditation visit, and we have other commitment. First, I would like to thank the organizing committee for inviting me, and I would like to send a special thank you to Dr. Abu Bakr Bashir. Actually, without Dr. Abu Bakr Bashir accepting me in the graduate program or the master program in Department of Pharmacology and Faculty of Medicine at Benghazi University, I will never be in this position. Also, I would like to thank Dr. Sulaiman Sharif. He's my master degree supervisor. Also, I would like to thank Dr. Abdullah Lehweji. He was my role model in my undergraduate program. So thank you all for your help and support. And again, special thanks to Dr. Abu Bakr Bashir. Thank you very much. So now I'll start with my presentation. In my presentation, I will be talking about advancing pharmacy education with a patient-centered focus. So I'm going to be talking about our experience in my previous university, which is University of Alberta in Alberta, Canada. So first I'm going to give you a brief background about pharmacy education in Canada. So pharmacy education in Canada is changing significantly with the introduction of the first entry-level PharmD program, which will bring pharmacy education in the 21st century. Organization playing roles in this transition include the Association of Faculty of Pharmacy of Canada, we call it the AFPC, and the Canadian Council for Accreditation of Pharmacy Program, and we call it CCAP. And there are also other provincial and national practitioner organizations. CCAP has now approved a new standard for PharmD as first professional degree programs. So each program must offer a total of 40 weeks, which is equivalent to 1,600 hours of experiential education. So usually at the early on in the program, it's early and the mid of program, a practice experience usually lasts for 8 weeks, which is equivalent to 320 hours. And usually this is considered in the bachelor degree. So usually people in the bachelor degree, they take between 8 to 16 weeks of experiential training. However, in the PharmD or entry-level PharmD, usually toward the end or the last year of the program, the student will take at least 24 weeks of experiential training, which is equivalent to 960 hours. Now I will talk about the chronology of pharmacy education in Canada. So this is started the way back in 1930, which was at that time the entry to the practice was via the apprenticeship program. Thereafter, around the year 1950, 4-year university bachelor program for entry to pharmacy practice was introduced. Thereafter, in 1960, this is where the first time 5-year bachelor program of pharmacy was introduced. Thereafter, about the mid-1960, the hospital pharmacy program was introduced. Again, in the mid-80s, the entry to pharmacy practice in Canada was only through the via bachelor degree program. And again, close to the 1990, the first post-baccalaureate PharmD program was introduced, and this was introduced mainly at University of British Columbia and University of Toronto, and post-bachelor diploma in pharmacy practice was introduced in University of Laval. In 2007, the first entry-level PharmD program was introduced at University of Montreal. Thereafter, in 2011, the entry-level PharmD program was introduced at University of Laval. At University of Alberta, in this year, the the post-baccalaureate, or it's not post-baccalaureate. We still consider it. It's an entry level, but at the post-bachelor level was introduced at the University of Alberta, and we are expecting to change this program entirely to entry-level PharmD in 2015. So why we did this change? So what the rationale for the change? There is a need for more highly educated graduates in order to serve the society. Also, the base of change across the profession to a higher standard or quality of pharmacy practice, for example, pharmaceutical care, need to increase. Also, increase the sense of professional dignity and status of the pharmacist comparable to other doctor title provider in the healthcare system. This is include physician and dentist. So this slide shows the development of PharmD program at University of Alberta. So first, we changed our curriculum to meet the PharmD requirement. Thereafter, what we did partial implementation of PharmD degree. For example, now we have a total of 130 students per year. So we selected just 14 students to continue for the PharmD, and the rest will graduate as bachelor degree. But our intention at the end, this entire program is going to be only PharmD. So we are doing phase-in PharmD program. This slide shows the structure of the bachelor and the PharmD. So usually in the first year, the student start the pre-pharmacy. Thereafter, we have 4 years of bachelor degree. So the student can graduate here with a bachelor degree of pharmacy. But the student who would like to go on and do the PharmD, they will add 12 to 14 months of experiential training. So this experiential training is divided in 2 sections. It's about 5 courses of classroom or didactic courses and 5 courses of experiential training. So in total, it's 10 courses, and this will be given within 12 to 14 months period. What's the program goals of this PharmD? Again, it's 12 to 14 months of combined didactic or classroom and experiential training. This further develop skills required for providing optimal patient-centered care, working effectively in a team, educating patient and team members, enhancing evidence-based critical appraisal skills. This is increased graduate confidence and proficiency, and exposure to a variety of practice sites, and this is enhanced preparation for pharmacists, increased scope of practice such as additional prescribing authority and ordering lab values. What the program outcomes? So the program outcome, it's actually developed based in 2010 AFPC educational outcomes. So we developed our program dependent upon the AFPC educational outcome for the first professional degree pharmacy program. What those outcomes? The first one, it's care provider. What care provider? That means pharmacy graduates use their knowledge, skills, and the professional judgment to provide pharmaceutical care and to facilitate management of patient medication and overall health needs. Another outcome, communicator. So pharmacy graduates communicate with diverse audience using a variety of strategies that take into account the situation, intended outcomes of the communication, and the target audience. Another outcome, it's collaborator. Pharmacy graduates work collaboratively with team to provide effective, quality health care and to fulfill their professional obligations to the community and society at large. Another outcome, manager. Pharmacy graduates use management skills in their daily practice to optimize the care of patient, to ensure the safe and effective distribution of medication, and to take efficient use of health resources. Another outcome, advocate. Pharmacy graduates use their expertise and influence to advance the health and well-being of individual patients, communities, and populations, and to support pharmacist professional rules. Another outcome, scholar. Pharmacy graduates have and can apply the core knowledge and skills required to be a medication therapy expert, and are able to master, generate, interpret, and disseminate pharmaceutical and pharmacy practice knowledge. Last outcome, professional. Pharmacy graduates honor their roles as self-regulated professional through both individual patient care and fulfillment of their professional obligation to the profession, the community, and the society at large. What are the program courses? As I told you earlier, there are 5 courses, and there are 18 credits in total, and this is mainly given in the fall term. What those courses are, we have evidence-based medicine, we have patient assessment, we have advanced pharmacotherapy, and this is 6 credits. All others are only 3 credits. Team collaboration and pharmacy education, seminar, and this can be given in either term. And we used a blended model of course delivery. So it's not all the lecture are just classroom lectures. Some of them online, some of them seminar type of lectures. And this may evolve to a distance program in future, like a distance learning program in the future. Advanced patient care skills and health assessment. What's involved in this course? It's patient care process, health assessment and physical assessment, laboratory values, care planning, and documentation. 503, which is advanced pharmacotherapy. In this course, explore selected topics using primary literature to critically evaluate emerging controversies and therapeutic dilemma. Overall objective is to further develop critical thinking and self-directed learning skills, a breadth and depth of therapeutic knowledge. Also case-based, problem-based learning to foster lifelong learning. This include team-based approach to research clinical topics, solve drug-related problems, and create patient care plans. Also to enable integration of knowledge and skill from other courses. 504, which is the frame for teams, collaboration, and education in pharmacy practice. This includes theoretical foundation to prepare students for a practice in an interprofessional team environment. Also include theory and practice of professional learning and education of patient and a group of patients. 505, which is PharmD seminar. This is a forum for students to demonstrate the ability to integrate knowledge and skills in pharmacy practice, including experience gained through coursework and experiential rotations. The overall objectives to further develop critical thinking skills and therapeutic knowledge, and to develop and deliver oral and poster presentation, enable preparation for professional development. Assignment in this course will include oral seminar presentation and poster presentation. We talked about the didactic or classroom courses. Thereafter, we have the experiential training. The experiential training, it's up to 36 weeks. Again, remember, in our undergraduate program, we give about 16 weeks of experiential training. So if when you add the 16 weeks plus the 36 week, this is will exceed the 40 weeks which required by the CCAP. So this is about 6 rotation, each rotation it's about 6 weeks. In reality we have only 5 rotation or 5 courses, but the student can repeat one of those rotations to make it up 6. So if the student did not do well in one of the rotation, he can repeat that rotation. So student may be granted recognition for prior learning. So for our graduate, usually we give them 6 weeks credit because they already have, it's about 16 weeks of training and up to 18 weeks for practicing pharmacists, because some of the practice pharmacists have extensive experience, so we give them up to 18 weeks, but we treat this case by case. Also, there is a flexibility in choosing rotation in practice setting that align with career goals and interest. What the experiential training goals? It's to develop clinical and behavioral competencies which enable students to prepare for practice in evolving professional landscape, built on previous knowledge and skills to develop critical thinking and decision-making skills to promote functionality in any patient care setting. Experiential courses, so I will talk about each one. We have Pharmacy 511, and the purpose of this course to demonstrate, or this rotation, to demonstrate professional competencies in the provision of patient care and interprofessional team. Pharmacy 512, to demonstrate professional competencies in the provision of patient care in acute care setting. Pharmacy 513, to demonstrate professional competencies in the provision of patient care in ambulatory or community setting. Pharmacy 514, and this is a complete 12-week of experiential learning rotation by combining it with Pharm 511, 512, and 513. Finally, we have Pharmacy 511, which is specialty electives. This is design and complete a practice-related rotation, including objectives, activities, and evaluation mechanism. What the rotation objectives? So what the objectives of this rotation? We have general course objectives, and this is which is developed by the faculty based on AFPC outcome, and define clinical and behavior competencies to be demonstrated and developed while on rotation. For example, develop a care plan that prioritizes and addresses the patient medication therapy problems and wellness need. Also, we have rotation-specific outcome, and this is developed in advance by the preceptors with guidance from the coordinator of the course. Define the knowledge and skill to be developed during the rotation, and this is include assess a patient, for example, cardiovascular risk, compare and contrast treatment options for a patient with acute coronary syndrome, for example. What are the rotation and what's involved in the rotation? It's activities designed to develop an advanced scope of practice, increased level of performance, number and complexity of patients, increased dependence, practice environment integration, fulfilling an advocacy role, responsibility to educate peers. So this is the purpose of the rotations. What our student expectation? Assume responsibility for rotation activities, develop confidence and proficiency in the patient care process, practice in a professional and ethical manner, demonstrate self-directed learning, function under indirect supervision so they can work independently, and to communicate effectively. So these are student expectations. What are the practice setting requirements? It should allow a student to perform and accept responsibility for proactive patient care services, sufficient quantity and quality of patient encounters, adequate staffing to facilitate the preceptor involvement in the rotation, also must have an access to net care, this is in Canada, or resources and other medical records. What are the preceptors, or what should be qualified as a preceptor? So preceptor should have a practice experience and a proficiency in area of expertise, motivation and enthusiasm in teaching, precepting experience, the preceptor should have precepting experience, additional training, advanced scope of practice, and collaborative practice are asset. Again, Form D degree is not required to be a preceptor. So preceptor can be just a bachelor degree, because usually a pharmacist with an extensive experience are qualified to be as preceptor. Also, we have to train those preceptors, so preceptor training is required. Also, cultivate a learning environment by providing regular feedback. In conclusion, many individuals from different organizations combine their knowledge, skills, and foresight to bring pharmacy education in the 21st century. Our program represents an innovative design for a faculty of pharmacy curriculum. The program provides the knowledge base, attitude, and skills required for pharmacists. At the end, the student will receive an excellent structured experiential component to enable them to participate fully as a member of healthcare team in our changing healthcare environment. Thank you very much.
I just want to really thank Dr. Eimon Qadi for a presentation well done, well structured, and we need a BS of Pharmacy degree at King Saud University in 1986 and a PhD degree from the University of Mississippi in the US. Now, Dr. Khalifa joined the Suez Canal University as an assistant professor in the Faculty of Pharmacy, and he's, I think, specialized in biotechnology. Now let's give him the podium. Thank you.
3 years during the mid-70s, and I remember the Corniche experience very well. Unfortunately, I couldn't make it to Benghazi in 2013, but hopefully one day I will be able to visit once again. So this is Doha, and it's, as you can see, it's downtown Doha, and actually these days the weather is excellent in Doha, and you can have your walks and jogging and in the morning or late in the afternoon, and it's very pleasant during these months. On the other hand, in the summer it's pretty hot and we cannot really enjoy a Corniche walk. The outline of my presentation, I'll be talking about a little bit about the history of the pharmacy program at Qatar University, and then we'll talk more about the pharmacy curriculum. 2006, I was not around at Qatar University at that time. I only joined in 2010. But in 2006, the founding dean, Dr. Peter Jewison, was recruited from the University of British Columbia to start the first ever pharmacy program in the state of Qatar. And he shares with me some of his history. In the beginning, he was here in 2006, and he was presented with a study plan or a curriculum map that was suggested by the university to start the pharmacy program. And we call this the historic document. And luckily, he did not follow that plan because it was more of the traditional pharmacy programs or pharmacy curricula that is heavy on basic sciences and pretty light on the pharmacy practice and clinical components. So basically what he did, he threw the document away and created his own document that is more in alignment with the pharmacy curricula in Canadian universities. After all, the aim was to get Canadian accreditation from CCAP, which is the Canadian Council for Accreditation of Pharmacy Programs. So that was really an important step because based on that, the curriculum in the college went to the right direction. Here I say curriculum creation at inception versus later adaptation. So I would say that Fatah University, we were very lucky that the seed was planted, I guess, in the right environment, in the right way. So we started right with the appropriate curriculum, and then we hired the people who can deliver that curriculum and move it forward. It is much more difficult if you already have a curriculum in place that has been there for many years, and then now you're coming and saying, okay, we want to achieve Canadian accreditation, for example. Then you're going to have to make some changes, you're going to have to enter into arguments with existing faculty, and I think you know what I'm talking about. So that's a lot easier to do it this way than to go to the adaptation. Again here, first intake of students in 2007. Now, these are pharmacy students. They get into the program. At that stage, they're really not considered pharmacy students. And we call them general pharmacy or general science, because really based on their organized